Good morning, everyone. I want to thank you for coming today, and I'd like to recognize the individuals who are here with us. Dr. Claudia Fagan, who's Chief Medical Officer, Drs. Kiran Joshi and Rachel Rubin, who co-lead the Cook County Department of Public Health, and finally, in a challenge to my ability to pronounce names, Dr. Hoon, Dr. Lin, Dr. Diaz, Dr. Pirko, Dr. Konchek, Dr. Avery, Dr. Zhao. Did I do all right? Somebody correct me if I'm wrong. All right, okay. I'd like to give special thanks to Mrs. Glenn, who's joining us today, and she'll share her personal experience about getting vaccinated. We're here today to talk about the COVID-19 pandemic, and it's clear at this moment as a nation that we haven't made the progress that we hoped in controlling the pandemic. The pandemic is not over. I'm going to say that again. The pandemic is not over. We're experiencing a resurgence of the virus. We're currently averaging 385 new cases of COVID-19 per week. That's more than 100 additional cases than at the same time last year. So we're in a worse place than we were a year ago. Again, the pandemic is not over. We can't give up on the mitigation efforts that will help to keep us safe, like mask wearing and continuing to practice physical distancing. For almost a year now, we've also had a powerful tool widely available to help us curb the pandemic: 3 cutting-edge vaccines. While more than 60% of the residents of Cook County have gotten at least 1 dose of the vaccine, we need all of our residents who are eligible to step up and get vaccinated. Vaccination is the only way for us to stamp out this virus and protect those around us who are most at risk, including those with chronic health conditions and kids who are too young to get vaccinated. I'd like to thank the team at Cook County Health, including Cook County Department of Public Health. They continue to serve on the front lines of the pandemic day in and day out. They are working tirelessly to treat patients who have been impacted by COVID and to get people vaccinated. And you'll hear more about those efforts now. So I'd like to bring to the podium Dr. Claudia Fegan, who's our Chief Medical Officer of Cook County Health. Claudia?
Thank you, President Preckwinkle. As the President said, I'm Claudia Fagan. I'm the Chief Medical Officer of Cook County Health. But as a healthcare provider, I've seen firsthand what COVID pandemic has done to our country, to our patients, to our communities. We have 3 highly effective vaccines, as the President said, to protect us against the worst illness that this virus can cause. And we continue to see high levels of hesitancy, particularly among Black and brown communities. There's a long history of inequity in healthcare in this country. And that's why the individual relationships that we as physicians have with our patients are so important in trying to help people understand what they need to know about getting vaccinated. And it's those years of caring for patients that we have earned the trust and respect of the patients we serve. And we try to maximize that now to help patients understand how important it is that they get vaccinated. And that's why my colleagues and myself have joined in this ad campaign. We want people to know that as their doctors, we want them to get vaccinated. I hope that we have earned their trust and that the expertise we have will be used to help draw out the misinformation, the things that are on social media that confuse people, all of the noise around the vaccinations, and that it continue to be perpetuated by people of influence around the country. I tell my patients, if you won't get vaccinated for yourself, get vaccinated for your mama, get vaccinated for your dad, get vaccinated for the people you care about, get vaccinated for anyone in your community that you care about and you have concern for. The vaccines are safe and effective. They are safe in preventing serious illnesses, hospitalizations, and death. The 3 vaccines, Pfizer, Moderna, and J&J, were approved by the Food and Drug Administration only after rigorous trials were completed and the data was reviewed by the world's best scientists. The process to approve the vaccines was not rushed. They followed the stringent guidelines that we have set forth for years by federal regulators. The science behind these vaccines has been built off of decades of research. The Moderna and Pfizer vaccines are made with a new molecular technology that are more effective than most of the vaccines we have used in the past. They use molecular building blocks to create an immune response in your body, and it gives you immunity. This is how vaccines will be built in the future. I wish that the other vaccines that we've had all along, like the flu vaccine, were as effective as these vaccines are today. Despite some of the myths that you may have heard or read about the vaccines do not change your DNA, they don't make people infertile, they do not change your internal organs or workings, and they do not contain any controversial substances. The vaccines do not contain live virus. Again, they are safe and effective. If you've been waiting to see how these vaccines are going to play out and you want to see just what's going to happen, I'm happy to tell you your wait is over. The time to get vaccinated is now. More than 383 million doses of vaccine have been given in the United States, and the Pfizer vaccine has recently received full approval from the FDA. It is no longer on emergency use authorization. We must continue to educate and advocate to address the concerns of people who aren't sure that they want or need to get the vaccine, people who believe that they're healthy and therefore they wouldn't be affected by COVID. We've got to help everyone to understand that none of us are safe until all of us are safe, and that everyone must get vaccinated. COVID-19 has had a devastating impact on our patients and the communities we serve. The only way to get this pandemic under control, the only path to the future, is vaccination. If you have questions, you have to talk to your doctor. Trust us. Get vaccinated. Should I continue with these? So I want to add that in addition to the awareness efforts of Cook County Health and the Cook County Department of Public Health around the My Shot Cook County and the expansive hyper-local outreach that we've had, this month Cook County Health has launched a new and creative campaign centered around the trust that people have in their doctors, because we're in the communities where they live and we've been taking care of them for years. The theme of the trust runs through the multilingual campaign materials, including the television and print ads and even social media. Look for the commercials across TV channels, streaming platforms, including ABC, NBC, CBS, WGN, Fox, MeTV, Univision, Telemundo, Hulu, Canela Crossings, Polvision, and YouTube, as well as print and digital ads. We hope this trust emboldens people who remain unvaccinated to get their shot and outweighs the misinformation that is all too prevalent right now. I'd like to thank the physicians for participating in this important campaign and for the work that they do to build the trust in the vaccine. And as Ms. Glenn will tell you, these relationships between physicians and patients are critical. It is my pleasure to show you the latest version of our television and streaming ad, the Trust Us campaign. Thank you.
As a doctor, I'm asking you to get the COVID-19 vaccine.
The vaccines are safe.
Built off of decades of research.
The vaccines cannot alter your DNA, can't cause infertility,
And can't give you COVID. Getting vaccinated protects you and those around you.
even if you are young and healthy.
Vaccines protect all of us.
Trust us. Please,
Please.
Please.
please get vaccinated.
Very good, thank you. I think Israel Rocha has joined us, our CEO of Cook County Health, for a few words.
Good morning, everybody, and thank you for joining us here today, especially President Preckwinkle for her leadership during the COVID-19 pandemic. As we have discussed the status of the COVID-19 pandemic, we have really wanted to make sure that our goal is always to reach out to our patients in many forms and fashions. Sometimes that is in the patient's room, sometimes that is when they come to our hospital, sometimes in the hospital bed, and now more than ever through COVID-19 we're learning that we can also go to the homes where patients live, where they are with their family, where they work. And today's new launch of a campaign to make sure that people can get the advice that they need from the providers that they trust is essential to what we're doing today. Our Trust Us campaign is a way that we can take our doctors into the homes of families all across Cook County to make sure that they get the information they need. During COVID-19, we have seen that sometimes, in addition to the variants that we are confronting every day, misinformation can be one of the most critical informations in the spread of COVID-19. As everyone here will attest, having trust is a critical component of providing health care. While historical inequities have led to mistrust in medical institutions, in providing medications from different sources, Cook County Health physicians and staff have worked hard to develop these relationships of trust with our patients that we have cared for, now for almost 200 years as an institution. The goal for our team is to carry on Cook County Health's mission of creating a safe place for every individual to come to when they are sick. We want all our patients throughout Cook County to know one thing. If you are in pain, if you are hurting, you just need to get to our doors, to our providers, and we are here to help everyone. We are at a critical juncture in our fight against COVID-19. The virus continues to mutate, creating new variants. While we are fortunate that the vaccine works against many of the most common variants out there, we do not want to reach a point where that is no longer true. The power to stop that resides in our hands. Every time someone gets vaccinated, it becomes harder for that vaccine to spread. The ability to end this pandemic lies with each and every one of us getting vaccinated. The physicians that you have heard from this morning represent the thousands of doctors around the country who are imploring everyone to trust them, to listen to the information that they say, and to trust them when they say, get vaccinated. It is safe, and it is the safest way that you can be able to survive this deadly pandemic. I'm proud to say that Cook County Health has administered more than 907,000 doses of COVID-19 vaccine across the county. As healthcare workers, we also are leading by example, which is why all Cook County Health staff are required to be fully vaccinated by October 1st. This policy will ensure that Cook County Health is doing everything it can to protect our patients, our staff, and our community from infection. The science is clear. The COVID-19 vaccines are safe and effective. By setting an example, we hope to build trust in the vaccine to our patients and those who in Cook County still remain hesitant at this time. The decision is yours, and we encourage you to take it. Listen to the science, listen to the information, and listen to the example of almost 400 million doses that have been given. In the history of our country, we have never had a vaccine so widely dispersed and given to individuals to help stop a pandemic that is within our hands. Please make sure that you take the action to protect yourself and your family. I want to thank our Cook County doctors and staff for everything that they are doing to help stop this pandemic. All of our care team together are working to help our patients to prevent the spread of this deadly pandemic and to help our community, our public, our patients to make sure that they know one thing. Trust your providers, trust the science, and trust the information. And trust them when they tell you that it's time to get vaccinated. Thank you so much. I return to President Preckwinkle.
You want to say something in Spanish?
Sí. Gracias. Muchas gracias esta mañana. Estamos muy orgullosos de estar aquí para poder comenzar una campaña sobre los asuntos de visión, para poder discutir la importancia que es para poder agarrar la vacuna sobre COVID-19. En este momento es importante que nosotros tenemos el tiempo para poder mirar que en esta pandemia la cosa que podemos usar más para poder ayudar a nuestras familias es para poder agarrar la vacuna. En esta campaña que estamos hablando ahora, los doctores y los médicos y toda la gente de nuestro sistema aquí de salud están apoyando a nuestra comunidad que por favor agarren su vacuna. que tomen el tiempo para hablar con sus médicos, con sus doctores, toda la gente que ayudan para poder avanzar nuestra salud, que le están diciendo, como su doctor, que por favor apoyen para agarrar la vacuna. Es muy importante en este tiempo. La decisión y el poder para poder parar el COVID-19 es en las manos de nosotros. En la manera de agarrar la vacuna es la manera para poder traer un fin a esta pandemia. La decisión es de nosotros. Esta campaña es nuestra oportunidad para poder traer nuestros médicos para sus casas, para poder hablar con ustedes y sus familias de la importancia de agarrar la vacuna. Por favor, apoyen ese momento para poder tomar la vacuna. En este momento es importante que nosotros miramos los datos, miramos la información y tenemos seguro en nuestra ciencia que es importante que en todos los momentos difíciles de nuestra nación un comité a la ciencia, un comité para poder apoyar que los médicos los dicen, es importante. En este momento estamos con ustedes para poder apoyar el mensaje que es ahora tiempo para poder ganar su vacuna. Muchas gracias.
Thank you. Now I'd like Dr. Gregory Hoon, who's our infectious disease physician and COVID-19 vaccine coordinator.
Good morning. I'm Dr. Greg Hune, an infectious... There we go. Good morning once again. Infectious disease physician, and I'm the vaccine lead here at Cook County Health. Last week, the FDA Vaccines and Related Biological Products Advisory Committee recommended that the FDA authorize a booster of Pfizer vaccine for individuals who have completed the Pfizer vaccine series and are either 65 years and older or have pre-existing medical conditions that put them at risk for serious illness if they were to get infected with COVID-19. This includes people who have common medical conditions such as heart disease and diabetes, people who are severely immunocompromised and have received 2 doses of Pfizer or Moderna are already eligible for a 3rd dose. The recommendation made on Friday was important, but we must remember that it's just this, a recommendation. While the FDA generally follows the recommendations of the advisory committee, they could add additional parameters or expand eligibility as they see fit. For example, there have been discussion that people who are at risk for occupational exposure, such as healthcare workers, may be added to the FDA's final authorization. And it is also worth noting that the CDC's Advisory Committee on Immunization Practices is meeting on Wednesday and also plays a historically pivotal, strong advisory role in guiding vaccine administration. We expect formal updates from the FDA later this week with a revised Emergency Use Authorization, or EUA. Once we have the new EUA, healthcare providers, including Cook County Health, can begin offering boosters to those new groups. There are a few things I want people to know about the vaccines and boosters. Our current vaccines remain our best defense against COVID. They offer strong protection against severe illness, hospitalization, and death. Vaccinated people make up less than 1% of our nation's COVID deaths. And the overwhelming majority of people in our COVID units are unvaccinated. Vaccinated people may get infected with COVID, particularly with the more virulent Delta variant, but that's to be expected as no vaccine is 100% effective. But with the vaccine's protection, vaccinated people generally experience much more mild symptoms and far, far less likely to have severe disease. Some studies show that even if a person's immunity wanes slightly 6 to 8 months with their last COVID shot, that is far less likely to have severe disease. And some studies show that even if a person's after their last shot, it does not appreciably increase their risk for hospitalization or death. And the increased immunity from a booster now is most important for people who have other health conditions or older age that make them more vulnerable to disease. So while the discussion about boosters is a good one, we still have a lot of work to do to get everyone vaccinated. Today, 1 out of 3 suburban Cook County residents is unvaccinated. And because the number of unvaccinated individuals remains so high, the virus is circulating widely. allowing it to potentially mutate and putting more people at risk, particularly those that are vulnerable and cannot get vaccinated now. The infections and severe illness we are seeing now are largely preventable, and it just takes a shot. I'm also happy to say that we'll be able to offer COVID vaccines along with flu shots this fall. And I'm hopeful that people will take advantage of that convenience. If you're going in for one shot, I encourage you to get both flu and COVID vaccinations. Most healthcare providers should have their flu shots ready to administer in the coming weeks. And getting your vaccines is the best thing you can do right now to stay healthy and stay alive. Lastly, I want to comment on the data released today, earlier this morning, regarding the Pfizer vaccine dosage for kids ages 5 to 11. Their study results appear extremely promising and show that the Pfizer vaccine is safe and produces adequate antibodies that are expected to protect younger children. The data are being provided to the FDA for review, and it is possible that authorization for vaccines for kids ages 5 to 11 could come in the next month or so. Pfizer's research of the vaccine in kids under 5 is likely going to come by the end of the year, and I'll be happy to take more questions on this after our program. Thank you.
Can you leave the thing that tells me who's coming up?
Pardon me?
Thank you. All right. Thank you, Dr. Hoon. Dr. Rachel Rubin, and then Alexis Glenn, and Dr. Whitney Lynn. So, Dr. Rubin.
Thank you, Madam President, colleagues, press, for joining us this morning. So I wanted to talk a little bit about progress we're making in terms of the pandemic in our jurisdiction, and then a little bit about our hyperlocal outreach program. So we are making progress in our fight against COVID. Currently, we are right at about 1.5 million residents, or about 65% of the population in suburban Cook County, who have received at least one dose of the vaccine, and over 1.2 million, or 53%, that have received a complete vaccine series. The Delta variant has been the dominant strain in Cook County, but we are cautiously optimistic that it has plateaued, and we are in a downturn in case counts. Hospitalizations and ICU bed occupancy rates, however, are high now, but this is to be expected as these rates lag behind the case counts by 2 to 4 weeks. Future variants could indeed be more resistant to vaccines. They are created and spread in unvaccinated people. And to state it plainly, if you are vaccinated, you are much less likely to contract COVID, and if you do happen to be infected, you are much more likely to not suffer severe illness or hospitalization. So vaccinations protect you. The current vaccines are still highly effective in preventing serious illness even 8 months after completing the vaccination series. We will hopefully know more later this week about the CDC's recommendations for boosters. At this point, as Dr. Hoon has mentioned, an FDA advisory committee has recommended boosters for those 65 years and older, or with chronic diseases, putting them at increased risk for complications from COVID. We are continuing to vaccinate individuals with a third vaccine of Pfizer right now with certain immunocompromised conditions. The point is, the virus is dangerous, the vaccine is not. We've made great progress in the Latinx and Black and African American communities. Over 50% of the Latinx have received at least one dose, roughly equal to the white population. And African American residents are being vaccinated at much higher rates than earlier in the year. As we have focused our hyperlocal efforts in the southern suburbs, we are seeing much stronger results. And so now I will walk you through our hyperlocal comments, talking points on that. Okay. So we've always known that there are vulnerable communities with limited access and barriers to getting health care, and residents who are hesitant to receive the vaccine. Reaching these residents, communities, and neighborhoods take commitment, effort, resources, and time. Our Department of Public Health is relentlessly committed to ensuring we reach all suburban Cook County residents and that everyone has an opportunity to get vaccinated. Our hyperlocal approach to vaccinating suburban Cook County comprises several aspects. First, partnerships with community-based organizations. At the core of our efforts are our community partners. As trusted voices in their communities, they are helping us reach all residents. 2, our door-to-door program. We are walking neighborhoods with CCDPH workers and doctors and our CBO partners to discuss upcoming vaccination events and connect with residents on a one-on-one basis. 3, our program called Destination Vaccination. This is a transportation program, and we need to eliminate as many barriers to health care as possible, so residents can call 833-308-1988. That's 833-308-1988. And they can not only get a free ride to and from the vaccination site, they can find the most convenient site and make an appointment. Number 4, our community health centers. So partnerships with community health centers give us trusted static locations that serve vulnerable communities. And this includes the Ambulatory and Community Health Network of Cook County Health, as well as federally qualified health centers and other community-based health centers. And number 5, we have teamed with WGCI, the extremely influential hip-hop radio station, to have their on-air talent appear at several of our vaccination events to encourage listeners to get vaccinated, and we are excited by the latest tactic we are announcing today. For the next 10 weeks, we will be rewarding one resident each week with a $1,000 award. As part of our Life is Better Vaxxed campaign, residents simply need to upload a photo of themselves receiving the vaccine to wgci.com/lifeisbetter to be entered into the contest, and WGCI will choose a random $1,000 winner over the next 10 weeks. We are aware that our hyperlocal approach is having a slow but steady impact on vaccination rates across suburban Cook County, and we plan to continue until we are confident every resident has had an opportunity to get vaccinated. Thank you.
Good morning. My name is Alexis Glenn. I am a patient here at Cook County Health Center. I got vaccinated. I'm pregnant. But I caught the virus a few months ago. Luckily, with the help of my physician, Dr. Lynn, I am recovered, and now I'm expecting a baby boy any day now. After getting COVID-19 a couple months ago and being scared for my life, I knew I needed to trust my doctor and get vaccinated to protect not only me, but my unborn son, my family, and the community. It wasn't until I had multiple discussions with Dr. Lynn that I decided to get vaccinated. I know there are a lot of different bad information about the vaccine, especially on social media, but let me tell you, I had COVID-19 and you don't want to get it. We have to trust our doctors. I trusted Dr. Lynn. Trust your doctors. Please get vaccinated or this pandemic is never going to end. Thank you.
I am Dr. Lynn, and I did have multiple conversations with Ms. Glenn, and I am proud to say that she did after multiple discussions. But I also want to say I want to thank her for trusting us, not only to take care of her health and her pregnancy, but also today she will be having her baby boy. So we want to say thank you for trusting us to even have your kid with us. But I want everyone to know that as physicians, all of us here at Cook County, we are going to continue to have these conversations so that you do trust us. So even if you say no once, when you come back and see us again, we're going to have the conversation again, and we're going to keep having that conversation until you trust us and say yes. Thank you.
All right, I believe Dr. Arcia Diaz, is that right?
Yeah.
Close?
Got it, yeah. No?
All right, who's a pediatrician?
Yeah, thank you. Yeah, good morning, everyone.
Good morning.
So I'm going to be helping with remarks in Spanish. So we also want our Latinx community to be aware of all this information that we're sharing with you today. Yeah, sure. Thank you. Okay. All right. Buenos días. Mi nombre es doctora Arcia Díaz y soy una pediatra aquí en Cook County Health. Como doctor, generar confianza con nuestros pacientes es fundamental. Necesitamos que se sientan cómodos cuando nos vienen a ver, cuando están enfermos o cuando necesitan cuidado médico. Más del 60% de las personas en el condado de Cook se han vacunado contra el COVID-19. Pero desafortunadamente hay muchas que aún optan por no vacunarse. Es fundamental que la comunidad médica trabaje para generar confianza en la vacuna, y esto incluye tener conversaciones con los pacientes para descubrir el por qué no quieren vacunarse. Como doctora, les digo a mis pacientes que las vacunas son seguras y son efectivas, y que la vacunación es la mejor manera de protegerse a sí mismos y a quienes los rodean, sus seres queridos, sus padres, sus hermanos, sus abuelos y sus hijos, sobre todo muy importante para mí que soy pediatra. Un aspecto difícil de este último resurgimiento del COVID-19 es ver el impacto continuo de la información errónea sobre el COVID-19 y la vacuna. Esta información la vemos sobre todo en las redes sociales, la vemos en Internet, y mucha de esta información es falsa y nuestra comunidad debe estar informada al respecto. La vacuna es segura, es efectiva, lo hemos visto a través de muchos estudios hasta el día de hoy. Es actualmente nuestra mejor herramienta contra la hospitalización y la muerte por COVID-19 y fue desarrollada tras muchos años de investigación. La vacuna no se desarrolló de la noche a la mañana. Le estoy pidiendo a las personas que crean en sus doctores y en la ciencia del desarrollo de las vacunas sobre algo que han leído en el Internet. Por favor, confíen en sus médicos y no en lo que una persona que no tiene conocimiento incluye en Internet y las redes sociales. La vacuna puede salvarle la vida a usted y a sus seres queridos. Créanme cuando les digo, por favor, vacúnense y confíen en nosotros. Gracias.
Thank you. Next, Dr. Christoph, and help me with your last name because I don't have my pronunciation here. Pirko, there we go. Dr. Christoph Pirko, who's an internal medicine physician.
Thank you, Mr. President. Good morning.
Good morning.
My name is Dr. Krzysztof Pierko, and I will address our Polish population in Polish. Dzień dobry, nazywam się Krzysztof Pierko, jestem lekarzem internistą i pracuję w szpitalu Cook County od ponad 12 lat. Kampania Zaufaj nam jest niezwykle ważna, ponieważ zaufanie pomiędzy lekarzem a pacjentem jest niezbędne w uzyskaniu terapeutycznego efektu. W ostatnich miesiącach jest coraz więcej dezinformacji pokazującej się w mediach społecznościowych, które zaburza to zaufanie. Musimy jako lekarze wyjść naprzeciw naszym pacjentom, ich rodzinom, aby pomóc im zrozumieć, na czym polegają szczepionki, jaka jest ważna rola szczepionek w ochronie zdrowia nas wszystkich, naszych rodzin i naszych społeczności. W okręgu Cook County ponad 60% pacjentów już się zaszczepiło. Niestety odsetek ten w środowiskach polonijnych jest znacznie mniejszy. Szczepionki są bezpieczne, szczepionki są efektywne i zapobiegają hospitalizacji, jak również śmierci z powodu COVID-19. Musimy pamiętać, że szczepionki nie powstały z dnia na dzień. Są efektem pracy wielu naukowców i ogromnych nakładów finansowych. Powtarzam, szczepionki są bezpieczne i efektywne. Szczepionki nie zawierają żywego wirusa, szczepionki nie mają wpływu na nasze DNA, nie powodują bezpłodności, są po prostu bezpieczne. Zaufajcie swoim lekarzom, zaufajcie nam, kiedy mówimy, że należy się szczepić, aby skończyć z pandemią COVID-19. Trust us. Dziękuję bardzo.
Thank you. All right, Dr. Emily Zhao, who's an emergency medicine physician.
Okay. Thanks. Good morning. I'm going to be addressing my remarks in Mandarin for our Chinese community here. Okay. 你好，我是赵医生，在 Cook County 急诊科工作。作为医生，与患者建立信任很重要。虽然有60%以上的人在 Cook County 接种了疫苗，但是还有许多人还没有接种。最关键的是，医学工作者必须努力建立对疫苗的信任，这包括与患者沟通，并花时间找出他们不接种的原因。作为医生，我告诉病人，疫苗是安全有效的，接种疫苗是保护自己和周围的最佳方式。最新的 COVID 急诊的困难方面，是感到有关 COVID 和疫苗的错位信息的影响。每天我和各地医疗同事都在治疗那些因为错误的新闻而选择不接种的疫苗的患者。疫苗是安全有效的，它是我们预防 COVID-19 病人住院和死亡的最佳工具。它是建立在多年的研究基础之上的，而不是一夜产生的。我希望人们相信我们的医生和疫苗的科学，而不是网上的错误的信息。疫苗可以挽救你的生命，相信我们，请接种疫苗。谢谢。Thank you.
Thank you, Doctor. Dr. Ishmael Avery, who's an emergency medicine physician.
This is Chicago. Get vaccinated.
Short but sweet. All right, Dr. Konchak. Didn't mess it up too much? Okay.
Good morning.
Good morning.
I am Dr. Julie Nowinski-Konchak and a preventive medicine physician here at Cook County Health. I want to echo everyone's sentiments and urge those who remain unvaccinated to get their COVID-19 shot. There are too many young, healthy people who are being struck down by this disease. Many of them don't think that they are at risk of getting sick or think that they can fight off whatever infection they get. Others have been influenced by falsehoods being spread on social networks and the internet. Let me tell you the truth. The vaccines work, they are safe and life-saving. The side effects of the vaccine are nothing compared to a bad case of COVID. The shot doesn't magnetize you, doesn't contain a microchip, doesn't make you shed COVID. I got my vaccine in December and I'm 8 months pregnant. The vaccines are not dangerous to your fertility and your ability to carry a healthy baby. Pregnant women and babies are at risk for serious complications related to COVID, making it even more important for pregnant individuals to get vaccinated. Please get vaccinated.
All right, I think that's everybody, right? Okay. All right, particular thanks to the folks who provided us with commentary in Spanish and Portuguese. Polish, let's get that right, Polish and Mandarin. Okay, questions?
Is there anyone on the line with questions? Bernie?
Yes, I have a question.
Sure.
I'd like to ask Dr. Fagan a question.
Sure, come on up, Dr. Fagan.
Okay.
And the question is, Dr. Fagan, is, are you and others in the medical community frustrated, angry, things like that, over the people who, in the face of what seems to be clear-cut information, still aren't getting the vaccinations?
I wouldn't say that we're angry. Frustration does seem to be an appropriate descriptor. Every time we see someone who's seriously ill, and especially when we have people who, just as we're preparing to intubate them or put them on a ventilator, are now asking for the vaccine, and we're wishing that we could have gotten it to them sooner. So I think that we have to meet people where they are. As physicians, that's what we do for a living, and try to hear their concerns and answer their questions. The concern is that there's so many people out there who are not coming to their physicians to ask those questions, but instead seeking answers on the internet and social media. So we just want to be able to get out to more people so we can meet them where they are, answer their concerns, and convince them that it is safe and effective.
Any other questions?
I'm sorry, I didn't know there was anybody in the room. You would have taken me first. Oh, okay. Did I do something to you or what?
Hard to see such a big guy. It's hard to see around him. Any one of you obviously went through several years of college, student loans, probably still paying them off. What is this like, fighting this misinformation campaign against Facebook medical school?
So, you know, the reason I went to medical school was to serve my community. I wanted to make a difference in my community. So, yeah, it can be frustrating at times, especially when you are discussing this with folks who are well educated, and yet they have, you know, from Facebook or other media, social media, they hear things. And there are people who we know are influencers in the media, so sometimes it's don't confuse me with the facts, right? But I think that part of being a physician is being patient, to hear them out, and then to point by point discuss why a particular belief is not valid or not founded in fact. And what we have to remember is that anecdotes or single stories do not speak to the huge numbers that we as physicians can speak to. So while, yes, there are people who get vaccinated and have contract COVID, the overwhelming majority of people do not. And so it's really talking about the numbers as opposed to individuals. And I think that we can be very effective as long as we listen first and then respond.
By a show of hands, how many behind the podium are fully vaccinated? Have you heard any anecdotal evidence of this ad campaign working thus far? Someone coming in because they've seen this?
I have seen patients who responded in combination with that, you know, so they see the commercial and then want to know more. And I think that's what we're here for.
All right, thank you. I'm sorry for not acknowledging you first. Do we have other questions?
One other, budget-wise, how much is the ad campaign costing the county as far as trying to get the word out?
Dr. Israel?
We are committing to spend about $5 million, and then we are also adding and getting a lot of in-kind airtime from our partners in the media, as this is a public message we're all campaigned. Then we will see how much more we need to go after that funds are spent.
All right, I just add, you know, we've lost 670,000 people to COVID in this country, 1 in 500 Americans. So whatever we spend is worth it.
Any other questions on the line?
All right, thank you all.